As COVID-19 cases continue to rise in Oklahoma, it is sobering to learn that almost half of all of the deaths related to the virus come from nursing homes and long-term care facilities. This is where residents are especially vulnerable to the virus. 2 Works for You's Giselle Puente explains what could be behind this uptick and deadly statistic. Giselle.
Well, Mike, like you mentioned, this is a very sad reality that many families here in Oklahoma are having to deal with right now. I spoke with a doctor from Norman who focuses on the health care of older adults, and she tells me Oklahoma is not unique in seeing high cases and deaths coming from nursing homes and long-term care facilities. This is happening across the U.S. Now, Dr. Lee Jennings from Norman, from the University of Oklahoma, says there could be a few reasons for this, including the type of facility. In communal settings, she says it's easier for the virus to spread from person to person. Now, the close nature of physical care also increases the possibility of transmission, even if a staff member is wearing appropriate protective equipment. In Oklahoma, 238 people residing at a nursing home or long-term care facility have passed away from COVID-19, with Tulsa County having the second highest death rate at 43. So how do we keep this from getting worse?
When you and I wear a mask to the grocery store, we're actually doing what we need to do to protect those nursing home residents. Because community spread, if we're able to decrease spread in the community, we'll decrease spread in our facilities too.
Visits at nursing homes were allowed to resume on June 15th in a phased approach after an executive order from Governor Kevin Stitt, but many facilities continue to enforce strict visitation guidelines to avoid the spread of the coronavirus. Now, one of the latest victims who lived in a nursing home facility in Tulsa passed away last week from complications from COVID-19. We'll have her story coming up at 6. Reporting in Tulsa, I'm Giselle Puente, 2 Works for You.